So it's lovely to see you here today to learn more about our programs. I'm Professor Bashijuk. I'm the Head of Undergraduate Courses and the Director of Health Science at the School of Public Health and Preventive Medicine. And I work very closely here with my colleague, Kelly Allard, who is the Director of the Bachelor of Public Health. And we're really excited to tell you about the units that we're really passionate about teaching and the content and the impact that we have on our students and but also the population that we engage with. So a little bit about us and who we are. The School of Public Health is the largest school of public health in the Asia Pacific region. What does that mean? That means we have a lot of expertise and a lot of networks and connections that we bring into in our world-class teaching of offerings at Monash. We have quite a few undergraduates, but it's more of a bespoke, tailored program where we engage with our students in facilitated tutorial activities. We teach across many degrees. So we have the Bachelor of Health Science and the Bachelor of Public Health that you'll hear about today, but also we teach into the medical degree we also teach biomedical students and engage with many of our allied health colleagues, as you'll learn about more today. We are bit fast. We are ranked 24th in the world in terms of public health and 32 in the world in terms of clinical and overall health teaching. Our vision and the vision that we hope to share with you is better health and well-being for all. And this is part of the values that come from our School of Public Health and is embedded in our research and our education practices. These themes really manifest in our values, which you can see on the side of the slide, which is to innovate, focus on impact, look at challenge inequity, to foster sustainability, strive for excellence, and champion diversity and inclusivity. And they're really bridged under these four themes where we make a difference, and we hope that our graduates will take this impact and translate it into the work that they're doing. So the four areas are safer and healthier communities and environments, effective and high-value prevention and clinical care, trusted evidence for practice policy and service delivery, and we want to make sure that we have a future-ready health workforce and workforce in public health. So we know that studying with us makes a difference, not just locally, but internationally as well. So what is public health? I think this is the most important question that we could probably answer here today. Public health is not when we focus on one individual. It's not about diagnosing a condition. It's actually about focusing on the population and making a difference across that population. We focus on health rather than disease and preventing those diseases from happening. And this can manifest in many ways, but in our themes, we have safer and healthier communities and environments. And some of the ways that we teach this, and one of the ways that you can learn to be part of that public health narrative is by engaging with robust data and innovative programs across these themes, which are behavioural and social epidemiology, global health, mental health and wellbeing, planetary health, public health genomics, and social cultural determinants of health. We prioritise equity, resilience, and that long-term well-being, and looking at that planetary health ecosystem that we live in. The next is that we are actually located at the Alfred Hospital precinct, and that's because we work really closely to inform clinical practice, and we work really closely with patients. So we want to make sure that those clinical guidelines that are coming out are of the highest level, and that's how we try to deliver the best outcomes for patients and the health system by informing it through the work that we do. And so work that you might be interested in informing after doing a degree with us could be working in acute critical care, age-related conditions, cancer, cardiovascular disease, general practice, musculoskeletal, or even women's health. So these are some of the areas we specialise in terms of clinical medicine. We also, one of the most important arms of our what is public health is making sure that we can tackle that misinformation pandemic that we find ourselves in. And we do that by teaching methodologies and really giving you the tools to understand what different types of information that you might be seeing. And that information and those tools are also used to inform practitioners, patients, and policymakers. So you can advocate for your own health and the health of others, but improve your health literacy through our programs. And that's for understanding biostatistics, clinical registry, clinical trials, evidence synthesis, and other topics on the slide. We are passionate about having a future-ready health workforce, and that's part of our mandate at the School of Public Health. And we do that through our undergraduate program, through the Bachelor of Public Health and the Bachelor of Health Sciences. But we also have postgraduate courses, including the Master of Public Health, where we train infectious diseases epidemiologists, for example, chronic disease epidemiologists, and lots of other postgraduate programs that are highly sought after by our graduates. But let's look at undergraduate now. We'd like to welcome you to where we teach. We teach at the Caulfield campus, and this is from Open Day. This photo, you can see our flags are out there. We're located at the Caulfield campus, next to the Caulfield train station, really accessible by parking, by bus. From Clayton, because we've got a free bus that connects the two. We use collaborative learning and teaching spaces. And in addition to that, we have a dedicated international student liaison academic. We have a student administrative support team. We have a great student society that's engaging and interactive. And because of where we're located, we really bring together interdisciplinary teams of student groups that come to learn with us to work out, and solve those big public health challenges. We're really aware that making sure that our graduates are career ready or job readiness. So placements and job readiness units are part of our courses. It's really important that we extend our networks that we have as a big school of public health to our graduates by connecting them. And this is just a screenshot of some of the logos that I could fit in on this slide to show you some of the networks that we extend from the school to you. I think it's really important that you see the student perspective. This student a few years ago did the placement, said, I went in that they didn't know anything, that they were a uni student, and they really learnt a lot and prepared a lot of skills that they thought they could use after the placement and during the placement. So a really good opportunity to really have that career clarification. We are focused on, there's a really good QR code here. If you want to look at what public health careers are, please look at this QR code. They have a full podcast that's been designed by our team at the School of Public Health, interviewing past graduates and different people who have gone into different careers that links directly to our courses. And here are just three of our recent graduates that we've picked, two from the Bachelor of Health Sciences and one from the Bachelor of Public Health. The one from the Bachelor of Public Health has gone on to do a Master of Public Health and is currently doing work in infectious disease epidemiology. So that's the bottom one. The one in the middle is the Bachelor of Health Science Honours graduate who's gone on to do the Australian Centre of Disease Control as a policy officer. And the top one has gone to work in the primary health network in northwestern Melbourne as a program support officer. But we're looking forward to seeing what they do and how they change the world and how they integrate into public health across the board. We are very proud of our graduates, and this one I had to put in there. This is our Bachelor of Public Health graduate, and this is Derek. Derek won this award the other day, and we're so excited to see that excellence and impact that our graduates are having. Derek won the Sir John Monash Model for Outstanding Achievement for 2025. This award is given, is given in our faculty. So the top 50 performing undergraduates in terms of academic score are considered for the medal every year, but it goes beyond that academic distinction. The awardee needs to show a commitment to advancing the university's goals in social justice, human rights, or a sustainable environment. And we're really proud of Derek, as we are of all our graduates. So congratulations to Derek, who made our day. There are many overseas opportunities, and Kelly could probably talk to this better than I can, as Kelly oversees the Indonesian Public Health Study Tour. Did you want to add anything about what?
Yep. So as we go along in the next few slides in this session, there are quite a few opportunities to study overseas within our degrees. In particular, we do have a global immersion guarantee at Monash for our health science students, but specifically for our public health and health science students, we also have an Indonesian public health study tour that students are eligible for, where they go and spend a few weeks overseas learning about the healthcare system in Indonesia. And this one, we've just highlighted, it's ongoing at the moment. Others pop up, every now and then. We might have something else that runs for a few years. This year, our students also have the opportunity to go to Vietnam. So sometimes like different locations, every few years. But this one is ongoing at the moment, and it's something that would be available to the students coming in 2026. And again, there's a QR code, and these slides are going to be online for you, so you can learn a little bit more about that if you like. So just really moving on a bit quickly, we're about to show you our different courses we have, but these are the key skills that you would learn in our degree that you can apply across lots of areas of the health sector. So you're going to learn about epidemiology, global health, a whole lot of biostatistics, data analytics. You'll learn about planetary health and different healthcare systems. Basically, our Bachelor of Health Science, I think we're going to talk about our Bachelor of Public Health first, which is really specifically about training the future public health workforce. And our Bachelor of Health Science is a little bit more open and leads to a whole lot of different areas that we're going to tell you about in a few minutes in our pathways information. So I'm just going to move straight on to the Bachelor of Public Health. So this is, I guess, our flagship degree in our area. This is for the students who really know that public health is what they want to do. Now, I know you can't read all this course map, and don't worry about it. I just wanted to show you that you will get a specific course map where there are multiple core units that we think are really important for your public health learning, things that you need to know to go on and then make the most of what we call selectives, where you start to choose an area that you might be more interested in. So you might decide to choose units that are about global health, or you might decide to choose the statistics and data analytics type of units, or you might want to go into policy and evaluation type of work. So without going through all this, you will have something like this when you come to Monash for just about every degree, which will guide you through your course. And of course, we also offer you advice when it comes to selecting which units you need or you want to do. The ATAR for this unit or for this degree was 80.15 last year. And of course, there is the Monash guarantee at of ATAR of 70. So our only prerequisites are English. You need to have a score of at least 25 in either units 3 and 4 or an English, English is an additional language. So that's the sort of thing you'll get when you come to Monash. And I also wanted to highlight that Schwartz is going to talk about psychology after us. Within the psychology degree, there is the offer of doing a public health stream. So just looking at the right-hand side, we've identified 6 units that are public health units that we think give you some really core skills that you can undertake within your psychology degree. And this would actually lead you into an accelerated Master of Public Health if you decided to go down that route. And an accelerated Master of Public Health means you do a 1.5-year master's instead of a 2. So this is actually for students who are enrolled in the Bachelor of Psychology, but they can still come over and they can still learn about public health with us. So I'm going to pass back to Barsha, who's going to talk about the Bachelor of Health Science because she's the course director for that degree. Thanks, Barsha.
Thanks, Kelly. We'll go to the next slide, please. So as Kelly showed you, we've got our course maps here. Now, the course code is M2014. So if you throw any of our course codes into Google, right, or just write the degree and Monash, it'll come up with these course maps immediately and you'll be able to see them much easier. Similar to what Kelly has now told you, the Bachelor of Health Science has the same core units as the Bachelor of Public Health. But in this case, instead of having a really tailored and a set of selectives that you can pick for public and pick different types of public health to get that real exposure across the discipline. Here you have a series of electives, and within these electives you can pick to do the global immersion guarantee. You can choose to do units from across the faculty and across the university, but you can also choose to do public health units. So there's a lot of that interaction between the 2 degrees, and we work really closely between the health science and the public health degrees in terms of our educators and our experts. Another degree and another offering that we have is the Bachelor of Arts Health Sciences double degree. This has a set course map. So this is what this course map looks like. It's a 4-year degree where on the right-hand side you have the health science units that are specific to to that degree. And on the other side, there are the choices from arts and where you have to go in that map. And it's a 50-50 map. So it has a different ATAR, and that would be an exploration of medicine and humanities, a really growing area. We couldn't go any further but telling you about our accelerated multivocational, how our courses are multivocational, and how taking one of these courses can actually accelerate your career. So with a Bachelor of Public Health, you automatically qualify for an accelerated Masters of Public Health and Master of Clinical Research Methods. So if you decide you want to be an epidemiologist like me, and you want to do all that solving and work out where the disease is, who's sick and why, you might then with a Bachelor of Public Health, you're automatically qualifying instead of for a 2-year master's, but for a 1.5-year master's, saving you 6 months of time and the costs associated. Similar with the Master of Clinical Research Methods. There are also pathways into occupational therapy, nursing practice, social work. And we're also cognate with Doctor of Physiotherapy and Podiatric Medicine. When it comes to Bachelor of Health Sciences, if you do the right electives and if you do the right units, you do also get those accelerated pathways. But again, this is a multivocational degree, and with the right electives and choices, then you can then move into those other pathways as highlighted on the slide. We provide all our students guidance from the outset about what are the pathways and what are the careers that they can do and how it links into it. But with something like the Bachelor of Psychology with the public health stream, that's just another way that you can qualify for an accelerated Master of Public Health 1.5 years.
Sorry.
Okay. I think oh, sorry, please.
There you go. Okay, so we just pop this all on one slide so you can see across the 3 degrees, different ATARs. They're all health science, public health are 3-year degrees. And as Basha mentioned, the double degree with arts is 4 years. We teach the health units on the Caulfield campus. If you're doing the double degree, there are some arts units on the Caulfield campus, but you may be moving between the 2 campuses. And you can see last year the ATARs for the 2025 intake to get a bit of an idea of what you're aiming for. And as I said, the English is the only prerequisite we have for our degrees. So I think we're going to move on and pass on so you can hear from one of our students, Hanan.
And if you have any questions, just flagging what Shui said at the bottom, this is a webinar, so there's a Q&A function. You can post your questions into the Q&A function and we can answer them there. But thank you for your time. Moving on to Hanan.
Thank you, Basha and Kelly. I'm not sure if my camera is on. Oh, there we go.
Welcome.
So to start off, good evening, everyone. My name is Hanan Omar. I'm currently in my 3rd year of the Bachelor of Health Sciences, and I'm going to just share a little bit about my journey so far. To start off, I'm going to talk about my classroom experience. One of the things that I've appreciated most is how interactive and discussion-based many of our classes are, whether it's tutorials where we're analysing real-world case studies or group projects that push us to collaborate and think critically. The environment really encourages engagement. And even in lectures, we're often prompted to apply concepts to real health issues, which helps us bridge the gap between theory and practice. Monash also emphasises teamwork and communication, which allows us to grow personally and professionally, and most importantly, prepares us for the collaborative work we're bound to do in our careers. I've also had some fantastic lecturers, one of them being Kelly, who are clearly passionate about what they teach, which helps make the content come alive for us students, and makes us enjoy the classes just that much more. To move on to the second point, which is the highlights of my degree, one of the biggest standouts for me is participating in the Global Immersion Guarantee. Now, Basha spoke about this earlier a little bit. We call this GIG for short, but essentially GIG took me to Italy in my 1st year, and it was one of the boldest and eye-opening things I've ever done. I was able to travel with a group of Monash students from degrees that I otherwise wouldn't have crossed paths with, and that diversity really made us kind of see different perspectives when working on group projects gets together and just made that experience that much more rich. While we weren't visiting as tourists, it was immersive. We stayed in smaller towns and met with local communities, heard their stories, and we explored global challenges from a health and sustainable perspective and really lived the culture. It was educational, entertaining, and absolutely stunning, as you can imagine, from Italy. We experienced things that we wouldn't trade for anything, and I came back having made friends for life. You can actually see us in that picture in the bottom, actually in the top right corner over there. Yeah, and if that doesn't already sound perfect, Monash actually covers the travel cost in your first year for gig. So it's financially accessible and it counts as a 12 credit point summer unit, like Beja said, for some of the units that give you flexibility in terms of electives. So this kind of allows you to then underload if you need to throughout the semester or take up another elective that kind of piques your interest. So like many of my peers, I came into health science not entirely sure what I wanted to do after graduation. And retrospectively, I see this as a huge blessing in disguise because it gave me the freedom to explore a wide variety of electives and really make the most of my university experience. I've taken units ranging from health law and ethics to maths and physics, which challenged me in completely different ways and helped me prepare for the postgraduate path I've now chosen. The flexibility of my degree is something I've really valued doing health sciences. It not only helped me discover where my passions lie, but also built up a diverse skill set that will be useful to me no matter where I end up in the health field. Another thing I'm incredibly grateful for is the range of opportunities that have come my way just by being a part of the health science community at Monash. In 2024, I had the privilege of volunteering at the World Health Summit, a regional meeting. And for those of you that don't know what the World Health Summit is, it essentially is a major international event that brings together global health leaders, researchers, policymakers, and advocates to discuss the future of health systems and equity. And as a volunteer, I had the privilege of sitting in on some of the key sessions and seminars, which covered topics like global health governance, climate change, and health, and digital innovation. It was incredibly inspiring to be surrounded by so many people who are driving real-world change and to see how my own future in health science could contribute to something much bigger. You can see us pictured in the top left picture. That's the group of the volunteers for that year. In addition to the external opportunities like the World Health Summit, Monash also offers a strong student community internally. I've been a part of the Health Science Society since my second year, where I started out as an events assistant. And this role gave me the chance to build confidence, gain experience in a low stakes environment, and contribute to some really fun and meaningful events. Now I'm proud to serve as the Vice President, and it's been one of the most rewarding parts of my university experience so far. Being a part of the MHSS has given me a tight-knit community of students who are all on a similar path, and it's been such a valuable experience, and it's given me a place to connect and grow and have fun both socially and professionally. And you can see us in that bottom right image over there at our end of year celebration that we held last year, which was pretty successful. You can see what a great community it is. And finally, to my aspirations, after graduation, I plan to pursue a Master of Medical Ultrasound with the aim of becoming a sonographer. Now, I've always been passionate about patient care and health communication, and sonography allows me to blend technical skill with the one-on-one patient interaction in a meaningful way. I'm currently gaining relevant experience through my work as a secretary to neonatal pediatricians, and I'm also in the process of searching for placement, which is one of the requirements to get into the master's program when coming out of health sciences. Ultimately, I hope to work in a hospital or clinical setting, possibly specializing in obstetric or pediatric ultrasound, who knows, and continuing to advocate for inclusive and compassionate care across all communities. That's all from me. Thank you for your time, and I'm going to pass it on to Swati.
All right, so I am the course director of the Bachelor of Psychology program, and my name is Swati Majumdar. So I just run you through what psychology is at Monash and what you can expect with your degree, what you can do with your degree, and what actually happens in the 3 years that 3 or more years that you would like to study. So if you look at the course overview, we've got our Australian qualifications framework, and the undergrad degree is the level 7 degree. And we based our learning outcomes on Monash graduate attributes as well, which aligns with the Australian qualifications framework. So you will, when you do psychology, you will, of course, understand and apply the principles of psychology and the theories and empirical findings across various themes. There's health, social, cognitive, there's cross-cultural, neuroscience development, etc. You can also conduct research. You'll be conducting research using multiple psychological perspectives. You will critically evaluate a range of research paradigms. You'll be using psychological tools, psychometric instruments. You'll also analyze the relationships between mind, brain, and behavior, because as you know, psychology is the study of the brain as well as behavior. And demonstrate professional competencies that are necessary for you to, if you want to become a psychologist or even in the actual world. So collaboration, critical thinking, the assignments, the assessments that we have basically help students to develop critical thinking. It helps them to develop interpersonal skills. It helps them, even reflective practice and other such values. As you can see, psychology at Monash in teaching excellence in 2024 was number 3 and number 33 in the world in 2023. So it is definitely one of the most wanted branches, and it's quite a competitive force. So at Monash, psychology, you can tailor your studies, because we have lots of electives. We've got streams, which I'll cover later, which you can choose if you're, interested in certain things. You can shape your future career. You can build a strong foundational understanding of the core areas of psychology. You can actually make a real difference by becoming a psychologist, by becoming a researcher, by becoming, and basically, like we say, since you're studying the brain and behavior, psychology is applicable to all areas of life and work. And you will learn from practicing psychologists and other experts in the field. So we've got a whole lot of maybe researchers doing cutting edge research in neuropsychology, in aging, in child development, so or in addiction. So you'll be hearing from those experts, and they'll also be teaching you as in your in different years. So the degree, basically the 3 years Bachelor of Psychology, is called as M 2018. That's the course code, M2018. And you can put it on Google and see what M2018 is all about. So it's 3 years, but there's an option of going into the 4th year, which is honors. Now, doing honors is necessary if you want to, do your master's later, or if you want to do your if you want to become a psychologist, or even if you want to pursue a PhD, a doctorate after your 3 years. So you need to do honors in order to be able to get into higher degree research or higher degrees. We offer this at Clayton campus. Psychology is offered at Clayton campus. There's also we also offer it in Malaysia, but that's different. But our course is offered at Clayton. If you have an interest in understanding people, and I think every student wants to understand people, mostly everyone wants to become psychologists. So if you have an interest in all this, if you have an interest in healthcare, wellness, mental health, neuropsychology, brain and behavior, that's neuropsychology, or even increase your cultural awareness, because we've got units that deal with cultural reflexivity, so and gain applicable skills, then definitely psychology at Monash is for you. Now, this is the latest information, the latest course update. So we've got 4 new accredited double degrees. So the M 2018 course is your Bachelor of Psychology. The 4 new accredited degrees, I'll come to that in the next slide. We've got new electives in streams. So you've got 10 core units in psychology that you must do. Then you can also take up different kinds of electives. We have 3 streams that you can choose from. So there are 3 streams: the mental health and well-being stream, the neuroscience stream, and the public health stream. Now, Kelly and Basha just spoke about public health and what you can do with psychology and public health. Mental health and well-being, neuroscience, they are also streams that you can choose. Now, it does not matter what streams you choose. It depends on your interest. You could be very interested in brain and behavior, so you can choose neuroscience, because the electives of neuroscience are basically they teach you about neuroscience. Or the mental health and well-being stream, if you choose, the electives that you get, or that you will choose, or you will get, you'll take, are they deal with mental health and well-being, and same with public health. So you will be doing the 10 core units in your double degree, the 10 core APAC accredited units. Now, what is APAC? It's our governing body, and it accredits our courses. The 4 new accredited double degrees are APAC accredited. So our governing body has approved and accredited those degrees. There's also the psychology extended major and the psychology major. However, the extended major and major can only be done if you're doing a Bachelor of Arts and Psychology or a Bachelor of Science and Psychology. So you do a Bachelor of Arts and you can do the extended major in psychology. So when you do that, you get a degree as the Bachelor of Arts. If you do the Bachelor of Science, you can still do the extended major in psychology, but your basic degree will be Bachelor of Psychology. I'm sorry, Bachelor of Science. So it's got the extended, and the extended major is fully APAC accredited, not the major. So extended major is where you'll be doing the 10 core units, like I just said before, and that is fully accredited by the Australian Psychology Accreditation Council, which is APAC. The double degrees that we offer are the Bachelor of Psychology and Bachelor of Arts. Now, I've given these codes over here, M 2019, 2021, and 301, L3014. I haven't given you the course map, but you can just Google it, or you can put it, in Monash Handbook M 2019, and it'll come up with all the options and in the prerequisites, core requisites, what units you should be doing, etc. So these are all 4 years, except the Bachelor of Laws and Bachelor of Psychology is 5 years. Doing a double degree in arts, commerce, or science, you graduate with a Bachelor of Psychology, Bachelor of Arts, or commerce or science, whichever you're doing. However, the Bachelor of Laws and Bachelor of Psychology, you graduate with a degree of Bachelor of Laws first, and then Bachelor of Psychology. So you can just put these in Google and see where the course map takes you. But one thing is for sure, all of these, whether you're doing the M 2018 or 19 or 20 or 21 or L3014, you still have to do the 10 core psychology units. So when you look at the psychology major, extended major, and minor, in the major, it's not APAC accredited because you only do 48 points, and you can credit points, sorry, and you cannot apply for a 4th year's honors in psychology because basically you haven't done the necessary 60 credit points that will help you get into the 4th year honors and then pursue a degree later on after honors. The extended major, on the other hand, and the course code is PSY CHOL09, that is APAC accredited. It is 60 credit points and eligible to apply for your 4th year honors. And then you've also got the minor. Again, the minor is not APAC accredited, it's just 24 credit points. And again, it's not eligible to apply for the 4th year. So you can't become a psychologist if you decide to do a major or a minor in psychology. You must do the extended major, or you must do the double degree to pursue becoming your dream of becoming a psychologist if you'd like to. We've also got placements for our students, and this placement is 3rd year unit, PSY 3034, and it's in the 2nd semester. We place our students in various organizations, and it's only increasing because the placement unit only started last year. There were so many, opportunities for students to go into, various industry or industries or work with psychologists, etc. Uh, we have so many students this year who are being placed, and there's so many industries and organizations who have come to us because they would like our students to be placed in them. We offer the placement. You don't have to do anything. However, it's only offered to the Bachelor of Psychology degree students. That is only to our M20118 course. It's not offered to the double degrees or the major or the extended major or the minor course. So it's only for our students, the Bachelor of Psychology students. So what happens in this placement unit? It's work-based learning. It's a capstone unit. You complete a unique project, you gain practical experience, you do a reflection, and you develop skills. And so many times, if the organization likes you and you like working there, it's quite possible that they could even employ you um, if everything works well. I think Basha, Kelly, as well as Hanan have talked about the flagship rich educational experiences, the gig as it's called. And Bachelor of Psychology students are eligible for this particular experience. And you just you need to have a minimum WAM, that is weighted average mean. That's what we call scores at Monash. So you need to have at least 50 in your first semester of study. So by the time you finish your second semester, you can be eligible, or first semester also, you can be eligible to apply for the GIG program. Not all courses offer this. M 2018 offers it. The Bachelor of Arts offers it. So like I said, you just need to look at those codes and Google and see what they can what units and what courses you can do. What can you do with a degree in psychology? Now, everyone wants to become a psychologist, but sometimes students come in thinking that, oh, yes, I want to be a psychologist. Many pursue their dreams of becoming a psychologist, but many also want to, at some point of time, they realize that maybe becoming a psychologist is not for me. So what can I do if I don't want to be a psychologist? What am I going to do with a degree in psychology? There are so many places and so many, ways in which you can utilize the skills and the knowledge that you've learned by doing your degree in psychology to the outside world. So you can do it in rehab, you can, market research, because, they need statistical skills, and we teach you statistics in your second and third year. Clinical psychology, child psychology, counseling, org psych, organizational psychology in the government, in education. And, this is just, the list is actually pretty long. These are just some of the areas that I have put here. You can also do, of course, you can do your PhD. You can be an academic, just like what I am. You can, be a researcher. You can be a research assistant. So options are many. The sky is the limit. It just depends on what you like and or where your interests lie. So what can you do? What is the further study? So completion of this degree, you have to first do the degree and then do your honors. And that's the first step to becoming a registered psychologist. Um, so the Bachelor of Psychology is the fourth year out of a minimum of 5. And I'll just show you the course map, or, the way you can become a psychologist. You can also, do a master's, or you can do a PhD. And you can do a master's in social work. You can do a master's in counseling. And like Basha and Kelly said, you can also do the master's of public health. So these are after honors, you can get into masters, and wherever your interests lie. If you like social work, yes. If you like counseling, yes. If you would like to do your PhD, if you'd like to be a psychologist, so there are various different pathways that you can take to utilize the degree that you've got, and of course to pursue your dream. So APAC, that is the Australian Psychology Accreditation Council, they have defined a pathway to becoming a psychologist. So you do the Bachelor of Psychology, or the Bachelor of Arts, Bachelor of Science, or any, so the double degrees, and then you do a fourth year. Now the fourth year is normally the on-campus honors, but then we also have the GDPA, as we call it, the Graduate Diploma of Psychology Advanced, which is an online course. So you can, it's a 4th-year equivalent course, and you can do that. Then you can also, after that, you can do the Graduate Diploma of Professional Psychology, or you can also do, psychology honors. um, that leads to graduate degree. So you've got the graduate degree now, and then after that you can do PhD, or you can do Doctor of Philosophy, that is clinical neuropsychology. You can do it in clinical neuropsychology. You can do the Master of Educational Development and Psychology, and also the Master of Professional Psychology. And like I just told you, the Master of Social Work, Master of Public Health, and Master of Counseling. So many options for masters. If you don't want to do a PhD, which is more, it's about 3 to 4 years, a master's could be about 2 years, or the accelerated masters that of public health, which could be 1.5 years. So this is the APAC pathway to becoming of the Australian Psychological Society. They use this pathway. So it's a long pathway. You have to do your 4th year to become a go ahead to become a psychologist. You can be general psychologist, general registration, or you can have an area of practice endorsement. That is, you can be a clinical psychologist if you want to, and that's a area of endo. So this is how you basically become a psychologist. A long way, but remember, you have to do your 4 years undergraduate. Then you can do your master's, or you can do a 5+1 internship. You can do a combined master's, PhD. So one important thing to remember is that you need to be, registered as a provisional psychologist in order to be a fully registered psychologist later on. And you can find this if you just go to, the pathways of becoming a psychologist in Australia. You can find this on the website. And yes, that's all from me. But I must also say that, we've got various societies, we've got buddy systems for students, we've got the mentoring program for new students, as academics, or we've got people who actually staff who help with this. So I'll pass it on to Maria, who is our 1st-year psychology representative. Thank you. Maria, over to you.
I'm just trying to turn my camera on. There we are. All right, I'll share my screen. Oh. So, hi everyone. I'm just going to be sharing a bit about my experience in psychology. So, starting off with the overall classroom experience, the classroom environment is amazing. It encourages critical thinking and open discussion. Lectures are often very interactive, and professors are blending theory and real-world examples to make complex concepts a little bit more relatable and digestible. Group work and class discussions and tutorials have helped me kind of appreciate different perspectives and improve my communication skills and meet so many new friends. Overall, the learning atmosphere is very supportive and stimulating, and it makes each class an opportunity to grow both academically and personally. So I am only a 1st year, so I only have about to finish my 1st semester. So I haven't been on gig yet, but you've heard quite a bit about it. I am able to do it, and I did apply for it. So hopefully I will be doing that by the end of this year. But just to talk about some units and all that. So there is such a diverse amount of units offered, specifically in the psychology course. I especially enjoyed there's a unit called Brain and Behavior where we examined psychology on a more physical scale, see what happens in the brain. There's a unit called The Science of Thriving, which has showed us different ways in which we improve our daily routine and improve our mental health. Of the practical components, we conduct like experiments and analyze data, which has helped me apply theory to real world situations. And these opportunities have not only like deepened my interest in the field, but also helped me discover potential career paths that I maybe haven't considered before. Finally, what do I hope to do in the future? So I came to Monash University already knowing what I wanted to do. So in the future, I do want to become a clinical psychologist, and help patients overcome any problems they may be facing and build a therapeutic relationship, and showing them so many different ways that you can overcome any challenges. So after my bachelor's degree, I'll be hopefully completing an honours degree and then 2 years of my master's in clinical psychology. And then obviously doing those 2 years of endorsement. So on my slides, I've just got a few photos. A few of them are from lectures that I've taken. The one just here with the symbol that is SNAPS, that is a very popular like society at Monash University, specifically for psychology and neuroscience, and it's such a great way to meet new people. And I highly recommend, if you will be commencing psychology, that you join. It's just so amazing. But other than that, that is everything that I'd like to share. Now I think we'll be doing more of a Q&A.
Thank you, Maria. I do have a question for Basia and Kelly. So if a student is looking to get into like global health and health policy, what are some units or electives that students can pick up? Sorry, you are muted, Basia.
Thank you very much. Kelly, do you want to start?
Okay, so we do have within our health science units a few policy, I can't remember the exact unit codes, but we have a couple of units around policy and health, culture and society. But I'd probably recommend a student interested in that use their electives to look at, there's a whole lot of arts units around international and global relations, and I think they would also be quite a nice fit together.
I think in the Bachelor of Public Health, we've got the unit which is PBH 1104, so global health. So that leans into a third unit, which is global and public health. And that's where we have some of the placements that you were talking about earlier today, Kelly. And then another unit that we've been working on recently is PBH 2008, Health Policy and Politics. But also there's culture, society and health. But if you're really interested in, like I say, an Indigenous lens and learning more about that population, we have an Indigenous health and cultural safety unit. And they just went on a really great field trip. That was part of their program, part of their actual classes, and really integrating that you know, the hands-on learning aspect and seeing how, you know, big populations are, well, how preventive health impacts populations and not the individuals.
Thanks, Basia. We did have another question as well in regards to gig. So for students who do the double degree arts and health sciences, would it still be possible to do the gig?
Oh, that's a very good question. I think so. I'd have to check. My question would be, I'd have to look at the electives that are available to them on the arts side, because there are multiple arts electives. So they could take that from the arts side. So they could take 12 points. The health science units are set, but they have selectives in 2 of those. So you can pick those selectives, but on the other arm, there are a number of art selectives that they can then choose. So I wouldn't, and considering gig as an arts unit, Kelly, you would, does that sound in line with your thinking?
I was just quickly finding the map because there are 2 in first year just open. It just says arts elective. So
And
it would be something you'd probably have to confirm with the arts faculty, but I do think you can.
And in the 4th year, there's also arts elective.
Yeah, you've got to
So-
take it. You're only eligible in your first year though.
Yeah, that's right. So you
So
would
you'd have to
take it
save those arts electives.
in the early.
What I would do if you were doing the double degree is I would probably enroll in the future professional futures units first and save your electives, because you don't get an offer for the gig until, I'm sorry, Maria mentioned when it is, but it's sort of middle of the year. So I would probably keep the electives free and do the one of the other streams, like a major or a professional futures unit, in your first semester.
But we have other global, like with the Indo-Pacific study, that the Chi programs, there's lots of global opportunity, like global interaction opportunities for our students across the program.
Thanks, Basha and Kelly. Kelly, I think you've marked one of the questions to be answered live. What are the statistics units like with limited math background?
So I would be not worried about the stats in health science and public health. I call them, this is just me, but I call them baby stats. And I think that we really are starting our students back in about a year 10 maths level. We're not expecting, we don't have a maths prerequisite. We really are expecting all that basic probability chance. If you can calculate a percentage, you're well on your way to be following what we're teaching you in stats.
But I think the thing where our numeracy extends itself, it's that it's in a health context. So it takes it out of, you know, the rats, the mice, the rolling of the dice that they might be doing in the classroom. And it's really about people and helping people and how, you know, health changes and who's sick and why are they sick. And we answer those questions.
Thank you. Swati, we do have a few questions for you. I think, yeah, you're probably typing away as well. So if you want to answer that live, that would be good too. So what would work placements look like for the Bachelor of Psychology?
Yeah, I was just actually answering that one. But look, the placements are, the students are placed in, as far I know that they're placed in aged care, they're placed in, with psychologists, they're placed in, in various community health-based organizations. And so it depends on what your interest is and whether we can place you in that. So they go there, and I think there's a minimum amount. I'm not sure whether there's 90 hours or more that they have to work. Not work. I mean, they're placed, and they do whatever the placement coordinators ask them to do. Like, for example, last year in the aged care setting, the students were placed. They were asked to develop a plan, for the elderly, for their diet, their health, their exercise routine, etc. So those are the kind of things that they do. Or they could just, if you're interested in becoming a psychologist, you might just observe, or maybe just do what the psychologist tells you to do. So there are various organizations where students are placed. Mostly they try to match what the student likes or would like to do, but that doesn't always happen because interests are varied, and we may not have those many organizations or those exact organizations to place students in.
Thanks, Swati. And we have a question in regards to becoming an actual accredited psychologist. So would you need to do a PhD to get down the accreditation route, or is a master's degree sufficient?
Yeah, Shwe, I can't hear you actually
Oh,
clearly.
can you hear me better now?
Yes, yes, yeah.
Okay.
Okay, so can
Yes.
you
So
just repeat the question, please?
we had a question here in regards to pathways to becoming an accredited psychologist. So is a master's degree sufficient, or will the student need to complete a PhD?
No, you don't need to do a PhD to become a psychologist. You can do a master's degree, but just look at the pathway if you're going to share the slide. So there is, I mean, you've still got to work under a registered psychologist, and you still have to do quite a bit more study after that. But yes, you do. When you do your master's in, the Masters of Counseling, you do become a provisional psychologist. But once you fulfill all the conditions of the Psychology Board of Australia, you can become a fully registered practicing psychologist. So you don't
Thanks,
have to do
Swati.
a PhD. You can, from honors, you can do your master's, and then you can go on to do the next steps to becoming a psychologist.
Thanks, Swati. And Kelly, As well as Basia, Maria, and Hanan, have you all got anything else to add before we conclude the session? Like any tips you would like to share with future students who are considering, your study area or a double degree consisting of your study area? Perhaps Swati, do you want to go first?
There was a question where what is the most challenging thing about psychology? Someone asked. Now, I don't know how to answer that question, but all I can say is that if you've got the passion, if you want to study, and you're interested in human interactions, then psychology is definitely for you. We've got students, we've got international students, and Maria, like she just said, that she's liked the classroom experience. And Maria, I'm pretty sure you must have made friends with the group debate because you all come from so many different schools and different places, and so putting them in a group, random group, allocating them, so students do say that they manage to make friends in the university. So I think just come with an open mind, and yeah, we guide you, we handhold you, and then guide you to pursue your passion and dream.
And Maria, do you have anything to add before we wrap up from a student perspective?
No, just adding on to what Swati said, like if you've got the passion, there are definitely like elements that are challenging, and obviously there are times when you don't understand something and it requires you to reread certain things multiple times. But at the end of the day, like you just got to think about it, like 6 years will be over eventually, 3 years will be over eventually. It's like you just got to get through it, and if you've got the passion, you can definitely do it. So yeah.
Thanks, Maria and Hanan.
I think similar to what Swati said, I think the biggest thing is to come into it with like an open mind. Don't be afraid of doing summer units. Don't be afraid of doing electives that aren't necessarily in your faculty. I feel like uni's the time and space for you to explore. You've got the support there. You've got tutors there. You've got so many resources. I feel like you're not really going to get a chance to explore your ambitions or your passions aside from your career when outside of university. So I think that's my biggest thing, is to look around, do what you want to do, enjoy, make the most of it. Yeah.
Thanks, Hanan and Basia or Kelly, if either of you would like to say a couple of words.
Kelly, I mean, I think we're both passionate about public health and health science teaching, and I think Hanan sums it up beautifully. I think come and discover what it is to make an impact on many people. May it be through psychology, where you help learn about behavioral sciences. Come learn public health skills, and you can do you can also work in different mental health health promotion areas, and you can do honours with us too, both from the Bachelor of Public Health and the Bachelor of Health Sciences. Come and explore areas that interest you in health, and take that passport and see what doors you can open for yourself. We're excited to teach you and engage with you, so please join us.
Thanks, Basha, Kelly, Swati, and our two wonderful students, Maria and Hanan. So that concludes today's session. Before we end, I would like to encourage all of you to join us this open day in August. So if you're looking to pursue public health or health sciences, that will be at the Caulfield campus on Saturday, 2nd of August. I've popped the link in the chat. And if you're looking at pursuing psychology, medicine, biomedical science, or anything along those lines, or the Bachelor of Science even, you can visit us at the Clayton campus on Sunday, 3rd of August. So the link is in the chat. You can register for it so you can get updates to specific info sessions as well. Thanks once again. The session was recorded, and you can find a copy of the recording on our study page about a week from now. All right, thank you all and have a good night.